How to make your water break. The amniotic sac, sometimes called the bag of waters, is a membrane containing a protective fluid that surrounds the baby during pregnancy. Usually, the membrane will rupture spontaneously around the onset of labor. However, in certain situations where labor is proceeding slowly, it may be necessary to have your water broken manually. Note that, according to the World Health Organization, labor induction should only be performed when there is a clear medical reason for it and the expected benefits outweigh the potential harms. Always consult with your doctor or midwife before making a decision about whether to have your water broken or not. Steps. 1. Begin by contacting a doctor or midwife. Never make the decision to break your water without first talking to a qualified medical professional. You will almost never be told to try to break your water unless there is a medical reason to do so, for instance, if you're taking longer than normal to begin labor. Inducing early labor by breaking the amniotic sac can have serious consequences, depending on the mother's current condition. The decision for inducing labor depends on many factors, which your doctor or midwife will be able to best assess. As a general, but not universal rule, if you're not in at least the 39th week of pregnancy and you don't have any pregnancy complications, you probably have no reason to break your water. However, doctors often wait until up to 2 weeks after a baby's due date to induce labor artificially. Amniotic fluid is vital for the growth and development of a healthy baby. Not only does it physically protect the baby from injury, but it aids in the development of a variety of the baby's physiological functions, including lung function. For these reasons, it's very important not to do anything to disturb the amniotic fluid until very late in the baby's development. 2. Have your membranes stripped by a doctor. Membrane stripping, sometimes called membrane sweeping, is a simple medical procedure that involves a doctor separating your amniotic sac from your uterine walls with his or her finger. This usually causes your water to break and labor to begin in the next few days. Doctors often perform this procedure to cause a water break and induce labor in the 42nd week of pregnancy. This procedure is somewhat uncomfortable and can cause lingering cramps for hours or days afterwards. You may have difficulty sleeping, which will leave you poorly rested when your labor begins. Because you want to be as well rested as possible before your labor, the decision to have your membranes stripped shouldn't be taken lightly. If your doctor refuses to strip your membranes, do not attempt to do it yourself. Stripping your membranes is an invasive procedure that has potential risks, among them infection. Membrane stripping should only be performed by trained medical professionals using sterile tools and techniques. It should also only be performed to help deliver a baby who is ready to be born. If your baby is not ready, don't rush your delivery. 3. Receive an amniotomy. If your labor is especially late or your doctor believes it's best to rupture the amniotic sac during labor, he or she may opt to break your water for you in a technique called an amniotomy. In an amniotomy, the doctor, or qualified midwife, uses a sterile plastic hook or a glove with a small barb on the end to break the bag of waters manually. This procedure is known to cause discomfort. However, in most of the situations in which it's performed, labor and delivery is imminent, so the end is in sight for the mother. 4. Go on a walk. The motion from light cardiac exercise has been known to cause a pregnant woman's water to break. However, if you do choose to go on a walk, don't push yourself. Straining your body late in the pregnancy is not good for you or the baby. Do not walk for more than an hour at a time. Wear highly supportive shoes that will protect your ankles and legs from unnecessary strain, and walk on flat surfaces as opposed to trails and hikes. Never exercise to the extent that you lose your breath or are fatigued. For one, it's never good for a baby to be short on oxygen, but wearing yourself out can also leave you tired and ill, prepared when your water does break. 5. Do other exercises, like squats. Some anecdotal sources claim that certain exercises, like squats, can cause a woman's water will break by increasing the pressure in her abdomen. There is little, if any, scientific evidence to support these claims. However, some women swear by their effectiveness, and small, controlled variations on common exercises like squats are unlikely to hurt the baby. As always, be very, very careful about exertion and stress on the body. 6. Have sex. The physical action of sex is anecdotally known to sometimes cause a water break. Sources that support this method state that the pressure from sex and the pelvic contractions that result from female orgasm can help break an amniotic sac that is nearly ready to break on its own. However, as above, little scientific evidence exists to support this method, so talk to your doctor before trying to break your water this way. Don't worry about giving your baby an infection. If the amniotic sac is still intact, the baby isn't in danger. Note: do not continue having sex once your water is broken. Sex will likely be the last thing on your mind in this situation, but this still bears mentioning because having sex after the amniotic sac has torn can introduce harmful bacteria into the vagina. 7. Massage your nipples. Stimulating a pregnant woman's nipples to imitate the sensation of a baby's suckling can release a hormone called oxytocin, which can cause contractions that lead to her water breaking or the start of labor. When attempting this method, first, talk to a doctor, then, if you're ready to try it, either gently massage your nipple and areola, the dark circle around the nipple, in a circular, rolling motion, or allow a baby, yours or a willing friend's, to suckle milk from your breast. This method, favored by natural birth advocates, is actually reported to lead to quite powerful contractions in some cases. Because of this, it's recommended to approach it slowly, massaging only for up to 5 minutes per hour. 8. Never attempt to make your water break without a doctor's approval. Just as the decision to make your water break is not one to be made without the advice of a physician, so is the act of manually breaking your water not to be performed, except by a physician. Near the end of a pregnancy, it can seem as if it will never end. Don't get discouraged and never attempt to break your water prematurely or against your doctor's wishes. Doing so can result in health complications, like infection and premature labor, that affect not just the baby, but you as well. If you're ever unsure about how to proceed with your pregnancy, talk to your doctor.